Dr. Evan Chait, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Simply Avante. Always forward. All right, so what we're gonna do now is called Voodoo wrapping. What I wanna do is apply some compression to the knee as you're squatting. All right, so what this is gonna do, it's gonna create proximal vasoconstriction, which means that we're gonna cause the blood vessels to constrict. We're gonna create a tourniquet around the knee. Then the moment I take the bandage off or the wrap off, it's gonna increase a lot of blood flow to the small muscles, which will help influence the pain that you're feeling on top of your kneecap, okay? So now we're gonna wrap it. And it's gonna feel snug as it can be, and it's gonna feel kind of awkward and uncomfortable. And this is something you can do at home, but you gotta be careful when you cross the joint. Okay, you don't wanna be in the joint space itself. And last thing you wanna do is don't keep this on for more than 60 seconds, because you could actually irritate or damage tissue. Now do me a favor, just squat about 10 times for me on both legs. How does it feel with the bandage on? Feels loose? Does it feel like it's giving a little bit more support and stability? Perfect. Now do me a favor, do a pistol squat on the one leg again. Let me know. That looks a lot better. Yeah, how'd that feel? Much better? All right, now do me a favor, just take a walk and come back for me. Good, and come back. All right, now on the single leg again, do a pistol squat and let me know how it feels. A lot better, percentage-wise, what would you say? That's great. All right, so we're gonna do it again. Perfect, good, now stand on your left leg again. That looked really good. How'd that feel?
A lot better.
A lot better? All right, now take a walk down and come back. Good, now single leg squat again. Give me a percentage. Less sharp, less sharp.